If you or someone you know is struggling to maintain sobriety from alcohol, this video could change everything. Today, we're doing a deep dive into Acamprosate, also known by the brand name Campral. It's one of the safest and most effective medications for helping people stay sober long-term. We'll cover exactly what it is, how it works inside your brain, who it's for, and what the research says. By the end, you'll have a complete picture of how this medication can be a powerful ally in recovery. First, let's talk about why medication is even necessary for alcohol use disorder. This isn't about a lack of willpower. Long-term, heavy drinking literally changes your brain chemistry. It messes with two key neurotransmitters, glutamate, which is like the gas pedal, and GABA, which is the brake. Alcohol slams on the brakes and eases off the gas. To compensate, your brain starts pushing the gas harder and becomes less sensitive to the brakes. When you suddenly stop drinking, your brain is left with the gas pedal floored and brakes that barely work. This is withdrawal. You feel anxious, irritable, restless, and can't sleep. Your brain is in a state of hyperexcitement, creating intense cravings as it tries to get back to the only normal it remembers. This is precisely where Acamprosate steps in to help. So what exactly is Acamprosate? It's an FDA-approved prescription medication specifically designed to help people maintain abstinence from alcohol. It's not a sedative or a tranquilizer. Instead, it works by rebalancing the brain's chemistry after alcohol is removed. Think of it as a neurochemical stabilizer. It's typically prescribed after someone has already detoxed and stopped drinking. Its main job is to support you in that critical early phase of sobriety. Helping you maintain abstinence is part of a comprehensive treatment plan that should always include therapy or counseling. Let's get into the science of how it works because it's genuinely fascinating. Remember that overactive glutamate system, the gas pedal stuck to the floor? Acamprosate gently eases off that gas. It modulates glutamate activity, which helps reduce those feelings of anxiety, restlessness, and agitation that are so common in early sobriety. At the same time, while it doesn't directly hit the GABA brake pedal, it helps your brain's natural braking system get back to functioning normally. The result is a more stable, calm neural environment. This is why people on Acamprosate often report better sleep and less anxiety. Most importantly, it accomplishes all of this without causing any high, grogginess, or cognitive impairment. Acamprosate has zero potential for abuse or addiction, which makes it an incredibly safe option for long-term use in recovery. The clinical evidence for Acamprosate is very strong. It has been studied extensively all over the world in thousands of people. Large-scale analyses of these studies consistently show that Acamprosate significantly increases the chances of staying completely abstinent. For example, in many trials, the abstinence rates for people taking Acamprosate combined with therapy were around 36 to 40%, compared to about 23 to 30% for those taking a placebo with therapy. That's a huge difference when you're fighting for your sobriety every single day. The research is clear. It helps you stay sober longer and reduces the frequency of relapse. It's most effective for people whose goal is complete abstinence, and it works best when started right after the detox phase is complete. This is different from another common medication, Naltrexone, which works by blocking the pleasurable effects of alcohol. Acamprosate works by healing the brain. So, who is the ideal candidate for Acamprosate? It's especially well suited for individuals who are committed to complete abstinence and are struggling with those persistent post-withdrawal symptoms like anxiety, insomnia, and general restlessness. If you've made it through detox but are finding it incredibly difficult to stay sober because of these feelings, Acamprosate could be a game changer. It's also a fantastic option for people who can't take Naltrexone, often due to liver issues. A major advantage of Acamprosate is that it is not metabolized by the liver. It's cleared by the kidneys. This makes it a much safer choice for individuals with liver disease, hepatitis, or cirrhosis, conditions that are unfortunately common with long-term alcohol use. On the flip side, who should avoid it? Because it's cleared by the kidneys, Acamprosate is not recommended for people with severe kidney impairment. Of course, anyone with a known allergy to it should not take it. The other major consideration is adherence. The standard dosage is typically 333 mg tablets taken 3 times a day, morning, midday, and evening. This frequent dosing is necessary because the medication has a short half-life, meaning it leaves your body relatively quickly. If you're someone who struggles to stick to a consistent medication schedule, this could be a challenge, and it's something to discuss honestly with your doctor. Let's talk about side effects, because every medication has them. The good news is that Acamprosate is known for being extremely well tolerated. The most common side effect by far is diarrhea. This is usually mild and often goes away on its own after a few weeks as your body adjusts. Taking the medication with meals can help minimize this. Other less common side effects can include mild stomach discomfort, gas, or itching. Very rarely, some people report mood changes, and like many medications that work on the brain, there's a standard warning about the rare risk of suicidal thoughts. It's crucial to maintain open communication with your doctor about how you're feeling. One of the biggest safety advantages of Acamprosate is its lack of drug interactions. You can safely take it with most other medications, including antidepressants, anxiety meds, and mood stabilizers, which is vital since many people in recovery are also being treated for co-occurring conditions like depression or anxiety. Let's quickly compare it to the other 2 main FDA-approved medications. We have Acamprosate, Naltrexone, and Disulfiram. As we've discussed, Acamprosate is a stabilizer. It reduces withdrawal-related distress and cravings, making it easier to maintain abstinence. Naltrexone works differently. It's an opioid antagonist that blocks the rewarding euphoric effects of alcohol. It helps reduce the motivation to drink and is often used to help people cut back on heavy drinking, not just quit completely. Then there's Disulfiram, or antabuse. This one works by creating a severe, unpleasant physical reaction if you drink alcohol, causing nausea, vomiting, and flushing. It's purely a deterrent and is usually reserved for highly motivated individuals who need that powerful negative reinforcement. In short, Acamprosate helps your brain heal. Naltrexone makes drinking less rewarding, and Disulfiram makes drinking physically punishing. So, how long do you need to take Acamprosate? The standard recommendation is for at least 6 to 12 months. Recovery is a long-term process, and your brain needs time to heal and restabilize. Some people may stay on it for 1 to 2 years, or even longer, depending on their individual situation and relapse risk. Its excellent safety profile makes this extended use possible. It's also important to remember what happens if you do have a slip or relapse. You should not stop taking Acamprosate. The medication is still working to help your brain heal, and it can make it easier to get back on track with your sobriety. I cannot stress this enough. Acamprosate is not a magic pill. It is a tool, a very powerful one, but it works best as part of a comprehensive recovery plan. The combination of Acamprosate for biological stability and therapy for psychological skills is where the real magic happens. Therapies like cognitive behavioral therapy or support groups like AA or Smart Recovery teach you the coping mechanisms, emotional regulation skills, and behavioral changes needed to build a sustainable life in sobriety. The medication quiets the storm in your brain so you can actually focus on and benefit from the hard work you're doing in therapy. Here are a few practical tips for success. First, take your doses with meals to help with any stomach issues. Second, set alarms or use a pill organizer. 3 times a day is a lot to remember, and consistency is absolutely key to its effectiveness. Finally, maintain an open and honest relationship with your healthcare provider. They are your partner in this journey. To wrap it all up, Acamprosate is a cornerstone of modern treatment for alcohol use disorder. It's a safe, effective, and well-tolerated medication that helps maintain abstinence by restoring the brain's natural chemical balance. It improves sleep, reduces anxiety, and quiets the cravings that can derail early recovery. For anyone who is truly committed to achieving long-term sobriety, Acamprosate provides the crucial biological support needed to rebuild a healthy, fulfilling life free from alcohol. If you think it might be right for you, please talk to a doctor or a psychiatrist. Asking for help is the first and most powerful step. Thanks for watching. Take care of yourselves, and please subscribe for more content to support your health journey. This video is for educational purposes only and does not provide medical advice. Always consult a qualified healthcare professional before starting or changing any medication related to alcohol use or addiction recovery.